We're Dr. Shield, and we do insurance differently than most companies. Things like simplifying details so it's easy to understand what makes us Malaysia's most innovative indemnity provider. As a Dr. Shield client, you'll enjoy comprehensive coverage with fewer exclusions. With some insurers, you'll only find out what's not covered when you make a claim. Our policy details are online and easy for everyone to understand. Competitive premiums that don't keep increasing. Many insurers increase their premiums across the board to compensate for losses. Dr. Shield limits the number of doctors insured from high-risk categories, so our premiums start fair and stay fair. Prompt dispute resolutions. We're pro-mediation because settlement and negotiation, instead of endless litigation, is better for everyone. Career and reputation protection. Typically, litigation can drain a doctor financially and emotionally. We limit the damage by both, so our clients emerge good names intact. And peace of mind, because a happy doctor is a good doctor. Our different approach to creating policies means we put you first, before us, so you can enjoy your career and sleep like a baby, even if you've just delivered one. Dr. Shield. Insurance with a difference.
Hello and good evening, everyone, and welcome to another medical legal webinar brought to you by Dr. Shield, Chubb, and DOBBS. And tonight, I'm very pleased to announce that the speaker is none other than Dr. Chi Hui Bing, who is not only a medical doctor, but is also a qualified lawyer, and he's also a DOBBS member. So I think this is the first time we've actually had a DOBBS member who is a lawyer and actually speaking to us. And the topic he's touching on tonight is informed consent in medicine. So I think it's very important because it's something we take every day. We have to make sure indeed whether or not our patients are informed and properly consented. So before I start, just some housekeeping slides briefly. Um, for Q&A, as far as possible, please use Slido. You can go to slido.com if you're on a laptop and enter 1295857 as the code for the event, or else you can scan with your phone, not the normal QR code scanner, and it can take you to the Slido app if you're on the phone for your Q&A. If you're new to our webinars, please do consider subscribing to our channel so that YouTube will keep you informed of our upcoming webinars. We aim to have two for you every month, one from the SGMC Grand Rounds, usually at the beginning of the month, and one from our medical legal friends, usually on the latter part of the month. Okay, doctors and dentists who are watching can claim points. The dentists have a pre-registration form listed here, dobbs.my/dentist0824. For the medical doctors, I'll display the attendance link at the end of the talk. All right, so without further ado, I'm going to start Dr. Chi's talk, which is pre-recorded. Then at the end of it, I'll bring on Dr. Chi on stage so you can ask him all the questions you want. Hang on, let me move back.
Okay, good evening to ladies and gentlemen. Thank you for attending the Medical Legal Series talk of today. I'm going to talk about one very interesting topic, that is informed consent. Are you informed and are you consented? As we know, we have four medical ethics as our pillar, that is autonomy, beneficence, non-maleficence, as well as justice. Nowadays, in our modern medical practice, we move towards a patient-oriented medical approach. It is no longer doctor know the best for their patients. Nowadays, patients has the right towards whatever treatment they have received, whatever the diagnosis you have made for them, and they should be given a right to choose. This is actually being highlighted in many cases. To name a few, one of the famous case in Malaysia it is called Fu Fiona. Informed consent itself actually goes beyond than a form. It is more on the substance rather than the form itself. It is not just a yes or no or even a maybe issue. MMC did provide guidelines on the informed consent issues. The most important guidelines is actually a guideline called Guidelines on Consent for Treatment of Patients by Registered Medical Practitioners. This is formulated by MMC in the year of 2016. What is actually a consent mean? A consent is referring to voluntary acquiescence by a person to the proposal of another. And subsequently, there must be an act reaching of an accord. Both parties, namely the registered medical practitioner as well as the patient, must have concurrence of minds. That means both of their minds must be crossing or meeting each other. And the consent should be voluntarily and willingly coming from the patients. There are various types of consent. Number one, implied consent. Second, express consent. Third, it could be verbal or non-verbal consent. The most important part towards medical practice would be informed consent, in which generally, if there is an informed consent, normally the consent obtained should be a valid consent, which is enforceable by the law of court. An informed consent was actually first used by Paul G. Gamhart in USA in one of the case. Okay, it could be said to have been given based on a clear appreciation and understanding of facts, implications, and future consequences of an action. Informed consent, because if we do the autopsy of this word itself, you can divide it into two parts, the information part as well as the consent part. It is very simple. The information element will comprise of disclosure of information, comprehension of information, in which to say a doctor or a medical personnel has the obligations to inform the correct information to the patients, especially in regards to material risk. So what does it mean by a material risk? A material risk here is being defined as a risk to which a reasonable person in the patient's situation would be likely to attach significance. I give you one example here. A sports person like our badminton player, all right, will have a lot of worries in regards to the knee operation that he's supposed to undergo, because he will need to know after the surgery, is he able to play badminton again? Whereas an elderly patient who suffer from osteoarthritis, he would just need to know whether he's able to walk after the surgery. So you can see from the example given here, the material risk varies from individual to another individual. Second part is about the consent element. The consent itself, like I said, should be a voluntary consent, and the patient should also in competent to give such consent. That is to say, for example, if the patient is less than 18 years old, the age of majority act in Malaysia requires a person, a legal person, to have a what we call legal capacity to enter into a consent should be more than 18 years old. Mental Health Act in Malaysia also said that if a person is of unsoundness of mind, he cannot enter into a valid consent. Furthermore, incapacitated patient, for example, patients that is not conscious, in coma, or even have some brain injury, they cannot give proper consent. Interestingly, in some of the cases, especially towards to the area of reproductive medicine, the court in Malaysia requires spouse's consent as well. All right. So, what are the material risks? Like I have told you, material risks will be based on individual to another, as well as the factual situation of a case. It subjects to two different tests. Number one, that is called reasonable patient test. That is to say, what a reasonable patient will want to know and will likely attach significance to it. Secondly, it is called particular patient test. What the particular patient you are treating would want to know and would like to attach significance to it. That is the example that I have given to you. The badminton player will want to know after the knee surgery, is he able to resume his practice or not in the badminton court? All right. To come across, we have elements of negligence. There are four main ingredients to constitute a negligence, especially what we are talking about here, medical negligence. The first being, there is a duty of care. This is very easy to be established in the court. Once you have this sort of patient and doctor relationship, there is a deemed duty of care here. Second, the party at fault shall breach that duty of care. That means to say, one doctor is performed below the par, below the standard of care required. Thirdly, there must be adequate or sufficient causation. Causation, that means damage is caused by the breach of duty of care. And fourthly, the patient should suffer some degree of harm as a consequence of that breach of duty of care. So, four important elements to constitute the claim for negligence. So, what are actually doctors' so-called duty of care? Duty of care itself is a legal term, It is not like our normal duties, to treat the patient, etc. So, this is the so-called court interpretations of what a reasonable or prudent lawyers, prudent doctors should do to the patients. That is to say, we have three important elements for duties of care here. That is to give informed consent to the patient. Number one, this form part of the duties of care among the doctors. Second, the diagnosis. We must be able to diagnose what kind of condition that patients come to us. And the third one is the treatment given to the patients must be in line with the standard of medical practice. Okay, three important duties. And we have several cases actually to show that the court had been evolved from doctors oriented practice to patients oriented practice. Last time we used to have this Bolam test. So long the doctors are able to practice in accordance to the right thinking members of medical society. Take for example, as we all know, we have conservative treatment or invasive treatment. Let's say in a particular case, I have taken the approach to treat the patients conservatively. Anything that could have happened on that particular patient, I cannot be called to have fallen short of my standard of care because my other colleague would have agreed that this patient should be treated conservatively. That means to say, in Bolam test, we compare apple to an apple, orange with an orange. So long the practice itself is deemed to be okay by our fellow colleagues or peers, you are not negligent. That is Bolam. But subsequently, we have cases like Rogers against Whittaker. This is an Australia case. This Rogers against Whittaker is being used in the case of Fufiona against Dr. Su Fukman. Actually, in case of Fufiona here, it is a tragic accident involved a patient named Fufiona. She had suffered from serious injury during that car accident, and the orthopedic surgeon at that material time opted to perform a spinal surgery on Madam Fufiona. At the end, unfortunately, the surgery did not actually went well, and the patient suffered from permanent paralysis. Because the orthopedic surgeon that time did not actually obtain so-called an informed consent from Madam Fufiona, the orthopedic surgeon was eventually found to be liable for medical negligence. Okay. The orthopedic surgeon actually practiced the same level of medical care. That is to have taken the approach to go in by way of surgery to repair the injury suffered from by Madam Fiona during the car accident. But unfortunately, what he did wrong was he did not inform what are the material risks that will be called one of the complications from spinal surgery. That is permanent paralysis. He did not tell the patient in regards to that. Therefore, he was caught with the liability. Okay, so ever since Fufiona, informed consent is part of the duty of care imposed on the doctor. Okay, this is by the eye of the court here. Okay, apart from that, we must also take note of the latest case, Montgomery against Lancashire Health Board. This is a UK Supreme Court case. Apart from whatever material risk that a doctor should inform to the patient, the doctor in this particular case must also let the patients to have alternative choice. That is to say, when you are proposing an invasive surgery to your patient, you must also at the same time advise the patient, look here, there is a conservative solution or conservative treatment available for you to choose. All right. Montgomery advised us to give a more comprehensive advice to the treatment of the patient. Please take note. So informed consent in regards to this topic per se, it is one of the very important element of medical negligence. It will go into the root to decide whether you have performed below the standard of care required, because informed consent and Bolam test is the component to decide the standard of care. Failure to give a good informed consent could result a disciplinary inquiry by Malaysia Medical Council. In some of the more westernized and civilized country, take for example UK or USA, failure to obtain a consent will actually cause the doctor to be liable for criminal assault or battery or even trespass to a person. That's why whenever you do a surgery, make sure the consent is well taken and well documented. Proviso 2 in Malaysian Medical Council guidelines, consent for treatment of patients by registered medical practitioners, said that generally a doctor cannot do a procedure, examination, surgery, or treatment without a consent from the patient. Okay, but however, it depends on the situation. If this is just a non-invasive type of examination, take for example, you want to use a tongue depressor to examine the throat, it will be all right without a written consent. Whereas if you are performing a surgery, for example, an incision and drainage IND surgery, without a written consent, this is not acceptable. Okay, so you have to practice the consent according to the situation of the case itself. So what are the contents of a good consent form? Number one, it should include the patient's identification. And secondly, it must also contain the details of the procedure or the surgery to be performed. And bear in mind, you must write in full sentence. Do not use abbreviation. Thirdly, please write down what are the type of anesthesia that you want to use. And fourth, who are the surgeon? Who are the doctors that going to do the procedure or the surgery? And fifth, if there is a possibility that the surgery shall change, the type of the surgery should change. Take, for example, a laparoscopic appendectomy, keep in view open. You must write like that. Because if not, what is going to happen is during the surgery, the micro-invasive or the non-invasive surgery that you are initially proposing to the patient did not materialize during the OT table time, you can easily convert to an open surgery without rushing to get a new consent from the patient's family member. Okay, normally in our practice, this type of rushing out to get consent from the patients will trigger the patient's family usually to have doubt that you have committed something wrong during OT. Okay, this is one of the factors why the family members start calling lawyer post-surgery. And number 6 is that you must highlight the nature of the procedure and also what are the potential material risks of that particular procedure or surgery. And 7, if there is additional explanatory notes required, please feel free to write inside that particular consent form. And of course, the consent form must have the signature or thumbprint of the patients, okay, and it must be dated accordingly, and also witnessed as far as possible, please witnessed by the patient's immediate family member or their next of kin. Okay, and at the same time, the medical practitioner should sign and stamp and date the consent, as well as the medical doctor should be also witnessed by third party, for example, the nurse on duty. Okay, so these are the 9 recommended information to disclose before obtaining informed consent. Okay, diagnosis, prognosis, and all the uncertainties attached to the diagnosis of the patients. The nature of proposed medical intervention should be highlighted very well. The expected benefit of proposed medical intervention, the potential risks of proposed medical intervention, and remember the Montgomery case that I've told you. What are the alternatives to the proposed medical intervention? 6, what is the progress of proposed medical intervention? Because some of the time, because the nature of the disease itself tends to progress, so there may be some variation or change to the current treatment. That one also you must tell the patients. Okay. Number 7, opportunity for a second medical opinion and seek further details. This is especially important in some risky procedure. Do not push your patients into, how to say, if the surgery is an elective one in nature, that is to say, please allow some cooling period for the patients maybe to approach a second doctor or to think about it thoroughly before they went into a final decision. Okay, and of course there are dispute of cost. Nowadays a lot of dispute and argument about the exorbitant hospital bill. You must also highlight what are the costs involved. Okay, and lastly, please name whoever the person that's involved in the medical intervention. Okay, who are the anesthetists involved? Are you the one and the only one that performed the procedure or surgery? Or is there any other medical assistant involved in this case? Okay. This is one example of anesthesia disclosure form. It is quite well drafted by Ministry of Health, in which to say it contains a very comprehensive information. Okay, I give particular credit to this anesthesia disclosure and consent form is because it includes not just some common risks, but also include extremely rare risks for all the patients. Okay, this is one of the example that all of us should take note, because most of the time negligence happens is because you cannot predict the outcome. It is because you fail to anticipate the risk, because the risk itself is a negligible one. It's a that means to say could be omitted one, but somehow or rather, by God's willing or by misadventure of the patients, it happened. Okay, so this caused disaster to your career. And these are the examples that I've told you. It must be signed and also witnessed by the patients, as well as you as a medical doctor, you should sign and be witnessed as well. Okay. So consent, one question here is that, is all the informed consent, especially for those invasive surgery, must be written or not? Okay, the answer for private healthcare, take for example, private clinic, private ambulatory daycare center, private hospital or medical center, the answer is yes, because based on section 47 sub rule 3, the Private Healthcare Facilities and Service Regulation 2006, the consent obtained obtained or cause to be obtained under this regulation shall be in writing. All right, that means the court will only recognize a written consent for private healthcare facilities. Okay. Second question, can the consent be signed over WhatsApp, email, fax, or even being photocopied? The answer is a clear no, because at this moment of time, we do not have any enactment of law that allows you to do so. So, regardless how urgent is the matter, a consent must be obtained physically. It cannot be done virtually. Okay, so electronic or non-original means of consent is not acceptable. Okay, so what is a so-called validity of a consent? The consent should remain valid so long the conditions of the patients remain the same. If there is a change of the nature and also the clinical symptoms or the cause of the disease change, and also it warrants you to change or formulate a new treatment plan for the patients, new consent should be obtained. You cannot use the old consent. All right, that one is very important. Nothing should be taken for granted. Okay, I give you one example here. If a patient suffer from chronic renal failure and he or she is required CAPD, in each and every time, please make sure that you have obtained a new consent from the patient. You cannot use the excuse saying that this patient is an experienced chronic renal failure patient. He did CAPD multiple times. He did the peritoneal dialysis multiple times. Therefore, no new consent should be obtained in this special circumstance. The court will refuse this argument. Okay, because each and every time patients will be subjected to risk, like for example bowel perforation, infection, etc. If you do not obtain a new consent, I'm afraid if anything goes wrong, you cannot protect yourself. Okay, very important. So repetitive consent. Okay, the standard of practice in Malaysia is that a good consent must be contemporaneous in nature. Take, for example, if you want to subject the patient to undergo a specific or a particular type of surgery, as far as it is practicable, please obtain the consent a day before the surgery or on the same day of the surgery. Do not take the consent like a week or a month in the previous TCA. Do not do so. Okay, and the consent itself, this is to say, must be timely, because you must allow the room for the patients to decide. This is the the decision made at that particular moment. There will not be so much argument about the remoteness of the decision. Like the thing you have decided to perform what we call an elective surgery a month ago, it will not be the same, if you have decided on the day. Patients can argue and you can suffer from so-called legal repercussion if they said that I actually changed my mind on the day of operation, but the doctor insists to perform the surgery on me. You will have a lot of legal hassle to argue this. Okay. And second thing, do not presume that the patient will have known the material risk and consented to the so-called periodic procedure. A good example here is the CAPD case that I have used. Okay. In regards to photography, audio, and video, you must take separate consent. Okay, this one uh, I think is very important for those who are involved in cosmetic surgery, orthopedic surgery, or whenever the conditions of the patients require you to take before and after picture. So we must take separate consent for photograph, audio, visual recording in this particular case. Okay. So what are other situations that warrant to have a consent from the patient? This is in regards to the release and emission of information. I have one very interesting case in which one of my my GP friend actually approached me because he had encountered problems in regards to Personal Data Protection Act 2010. He's practicing as a GP, in which to say this particular case here, he had seen a couple that came to his clinic to perform just very simple routine blood examination. And somehow or rather, 1 year later, the wife of the particular patient actually asked the clinic to provide her with a copy of blood test. The blood test itself contains some sensitive information that is about the sexually transmitted disease suffered by the husband. The GP friend of mine, without knowing that the both of the couple are actually in the lawsuit of divorce, released the information to the wife. At the end, the husband was very annoyed with the decision of my GP friends, and he threatened to sue and report to this personal data protection commissioner. Okay, this is one of the important area that you must take note. You cannot simply release the medical records to third party without patient's very own consent. Okay, very important. And secondly, HIV test, for example, this is in regards to our social cultural practice. Normally, if you want a patient to undergo retrovirus testing, you must take separate consent. Okay, and if you want to keep the organs or tissues removed at the surgery for educational purpose, this is to say, usually academician or university lecturers will have encountered this sort of issue. You must also obtain the consent from that particular patient. Okay, consent for sterilization, hysterectomy, or orchidectomy. In our practice, and we have several case law to suggest so, spousal consent is required. That means to say, you are not only required to take the patient's consent, you are also be required to talk to the husband or wife of that patient and obtain his or her consent, written consent. Okay. And the fifth one is often neglected: consent for release of patient data to another practitioner for treatment. Whenever you are releasing the data through emails or through referral, please make sure you have written the beginning that I have been duly consented to perform this, to do this referral by the patients and for their best interest. Okay. Patients actually have the right to refuse treatment. All right. Like I have told you before, this is no longer a medical practice that is doctor centric. This is a patient oriented medical treatment. So patients, regardless of how insensible, unlogical, irrational is their decision. If they refuse treatment, you cannot force the patient, you cannot compel the patient to enter into so-called the unwanted treatment by them. Okay, in Malaysia, so far we do not have any case law. Please do not become the first one. Okay, but it is general agreed that patients can refuse treatment, regardless of whatever consequence that could happen on them. What about advanced care directive? Some people call it as do not resuscitate, allow natural death, or even a living will. There is no codified statute or law said that advanced care directive is recognized by the court of Malaysia, but somehow, um, in emergency condition, the medical practitioner can actually treat the patients according to the patient's best interest. Take, for example, the patients went to you in a critical condition. He's not able to respond to you. GCS very poor, and you are not sure whether this patient has got this sort of advanced care directive or not. You can actually proceed to do resuscitation, CPR, intubation, whatsoever you think that is right to save the patient. You are not being caught to offend the rights of the patient. Whereas in non-medical emergency situation, the medical practitioner should consult the patient's spouse, immediate family member, or even the legal guardian to discuss about whether there is an assistance of this advanced care directive or not. If the answer is positive, take for example, patients already signed, please do not intubate me when I have collapsed, something like that. You should respect to that particular wish. Okay. So, exception for informed consent, emergency condition, which I have elaborated to you. This is being codified, Regulation 48, Private Healthcare Facilities and Services Regulation 2006. A consent of a patient may be dispensed when the medical practitioner believes that any delay will actually endanger the life of the patients. But this is not an absolute condition for you to go all out and save the patient. Your clinical diagnosis or your plan that time should be supported or should be reviewed by another registered medical practitioner. That means both of you, as a medical officer or the specialist of the facility, the medical facility, should co-sign the resuscitation plan, okay, to dispense the consent of that patient. Because I give you one so-called realistic example is that patients suffered from traumatic brain injury, so you need to do an open surgery for the brain to relieve the pressure, but the family is not around. But this is highly urgent condition. No more delay should be caused, because it will harm the safety of the patient. So both neurosurgeon can actually sign and verify this statement, and you can go to the OT table and perform the surgery. Okay, this is how it is. And secondly, court order. If the treatment is ordered by a court of law, the consent of a patient may not be required. Okay, but in Malaysia practice, so far I have not seen any court order of such. Okay, minor, for example, refer to those patients that less than 18 years old. Okay, only the parents or the legal guardian can give consent on behalf of their children under 18 years old. Okay, please be aware about that. And how about those patient that is unsound of mind, psychiatry patient? Okay, if it is an emergency situation, please get your colleague to call sign. If it is non-emergency, you can actually obtain consent from next of kin or legal guardian. Okay, and unsoundness of mind patients, you have to look at one particular statute that is called Mental Health Act 2001. If it is just pertaining to conventional treatment, generally no consent is required. But somehow for invasive treatment, take for example, invasive surgery, ECT, etc., a written consent is required. Okay. As we all may readily know, an unsound patient sometimes can have the period of normal period, isn't it? If that particular time he's normal and he can understand whatever the question and facts put forward by the medical practitioner, the patient himself should be given the priority to give consent. Otherwise, legal guardian or next of kin. And finally, if the next of kin or legal guardian could not be located, two psychiatrists can co-sign the consent. Okay. Next, I would like to share with you three interesting case law. The first case is Norizan binti Abdurrahman against Dr. Ether Samuel. This is about a 30 years old lady, G5 para 4, and she was actually having a surgery called termination of pregnancy. At the same time, she wished to insert IUCD during the surgery because she had um, enough family members and she doesn't want to have this baby actually. So what happened was the ONG specialist that treated the patient did not explain to her there's a risk of uterus perforation for this particular surgery. So this is exactly what happened. The surgery did not went well and there was a massive hemorrhage during the surgery. To save the patient's life, the ONG specialist had no choice but to remove the uterus as well as ovary of the patients in order to save her life. Okay. Since the ONG specialist did not actually disclose the material risk to the patients. And one more important point in this particular case law is that the spouse consent is not obtained to remove surgery and also to remove ovary. Therefore, the court said that the doctor is liable for the mistake. Okay? Another important point is that this case had actually caused regression, That means to say Malaysia from here backward to another backward step lah, go another regression. It's because the court actually said that since the doctor repetitively apologize for the mistake, say sorry to the patients through WhatsApp, and also verbally apologize for the mistake. Therefore, the court actually said that since the doctors had apologized, this is a form of admission of guilt. That means to say doctors already admit to their mistake for apologizing. All right. But as we all know, by right, to show empathy to the patients, a doctors should be more open, to say sorry, all that. Okay, but unfortunately, after this case, all the lawyers will actually advise the doctors you cannot apologize, regardless how wrong you are and how much loss the patient suffered. This is because of this case, no reason. Okay. And second case is Gurmit Kaur, anak perempuan Jaswan Singh against Tongsheng Hospital. This is also another ONG case. This particular patient is a 38 years old lady. She is actually consented for removal of a cervical polyp, in which the ONG specialist here agreed that this is just a minor surgery and can be easily done. Okay. But somehow or rather, something went wrong during the surgery. The surgery did not went as suggested by the ONG specialist, but it turns out to have massive bleeding again. And the doctor again have no choice but to remove the whole uterus. Okay, so the court actually in this particular case held that number one, patient's consent should be sought since this is involving reproductive field of medicine. Okay, because without the uterus, the lady cannot be pregnant anymore. So the harmony of the family could be disrupted. All right. So patient's husband life could be affected. Okay. Second thing is that the consent is just limited to polypectomy. It does not extend up to the level of hysterectomy. Therefore, the doctor would be caught for negligence. All right. So this is how it goes. Okay. The third case, now, even I have told you that spousal consent is normally required for reproductive surgery, but somehow or other, the court had actually encroached its arm into non-reproductive surgery field as well. Okay, I want to share with you one case called Abdurazak bin Datuk Abu Saman against Dr. Raja Badrul Hisham. This is a case involved an elderly lady, 71-year-old lady, that suffer from intestinal obstruction. Okay, and he was treated conservatively, but the doctor actually proposed to the to the lady, that she ought to be inserted a rice tube, but the patients refused the rice tube insertion because of irritation and discomfort caused. Okay, so no rice tube insert. However, the intestinal obstructions condition did not improve with conservative treatment, and it warrants an emergency laparotomy. Okay, because the doctor did not insert a rice tube during the intubation process, the patients aspirated and suffered from aspiration pneumonia. Subsequently, the patient died as a complication of aspirated pneumonia. In this particular case, the court said that by right, the doctor should discuss with the patient's husband, who is a dominant view of the patient. That means to say, let's say most of the time, if the patient depends on third party, be it the family member or the spouse, in order to make a so-called valid medical decision, the doctors will need to discuss with this third party and obtain relevant consent. Okay, due to due to the not availability of this spousal consent, the court ruled that the doctor is liable for negligence. So this is how it is. Okay. So make sure you understand these three cases well, and uh, somehow or rather, if you have a so-called legal counsel in your hospital or facilities, please do consult them with the issues of double consent, especially referring to Gurmit Kaur case, Norizan case, and also Abdul Razak case. Okay, just a recap to all of you before we end this meaningful session. Okay, number one, to constitute a good standard of care, it comprises of informed consent, which is governed by the case of Fiona. Like I've told you, you must disclose material risk to uh, two types of tests, if you could remember: reasonable patient test and also particular patient test. Material risk should be disclosed to them. And second, in regards to the diagnosis and treatment plan offer, please make sure your practice is in line or on par with other medical colleagues or peers. That is your Bolam test. All right. And take home message: make sure in every medical notes the documentation is perfect. Number two, do not tamper or embellish the medical documentation. In the event some negligence really happen, leave it as it is. Do not go and alter or cancel, put in new pages, because lawyers, they are very smart. They will detect your foul play. Okay, you'll be caught for criminal offense. And third, record the consent as far as possible in written form. And fourth, the consent must be properly dated, signed, attested by witness, and the details of the operation must be written in full format. All right. With this, I thank you very much for listening, and I welcome the floor for any further question.
Thank you very much, Dr. Chi, for the excellent presentation. We've actually almost reached 2 hours, so I'd like to invite Dr. Chi to the stage to answer any questions that you might have. So, welcome, Dr. Chi, and congratulations once again for a very clear and comprehensive discourse about informed consent. So, let me see if there are any questions on our Slido. Yes, indeed, uh, there are. So, let's start with the top one. What happened to those patients who had annual checkups under their company? Company wants a copy of the report, including laboratory and imaging. I suppose it means is the patient's consent required to release it to the company?
Okay, actually, in this sort of case, you will require a written consent from the patient in order to release the medical laboratory test to third party. Please make sure that, because you will not want to get penalty under Personal Data Protection Act. The fine is actually reaching 300,000 for personal offense, and also can reach up to 500,000 if you are working under a company. So this one is very important. You cannot disclose at all, please.
Okay. Second one, what happens if we don't send the final field bills, lab, and imaging report to the insurer? Would they refuse to pay? I'm not sure there's anything to do with consent, but more like insurance payment.
Well, they refuse to pay. Yes, they refuse to pay. So long if they don't receive the claims, they can refuse to pay. Maybe just a little bit sharing, because recently I have one case that approached me. There was a patient that had some previous medical a history whereby she failed to disclose it to the insurance company, and then the doctor on duty that time, now, wrote certain things about the past medical history of that particular patient. So, as you all may want to know, as a registered medical practitioners here, insurance law required utmost good faith in terms of giving disclosure. So, if let's say this is not so irrelevant, irrelevant to your current claim, you are quite advisable to make your this clinical reports that you wanted to submit to insurance company, make it short and sweet. Do not put some extra things, because there are a lot of cases whereby insurance company refuse to pay, and then the patients will go after the doctors, who wrote the lengthy report. Hmm.
Okay. Yeah, extensive and worrisome indeed. We'll tackle some of the issues there, but that's a question regarding photos and images in ophthalmology. Must we take consent for every visit? Every time you
Actually,
want to
if
take a
it is
photo, yeah.
involve the body part of the patients, uh, if you want to be safe, just put it at your, I mean, receptionist counter. Make sure patients sign every time. Lah. I know you are busy and you feel burdensome with repetitive consent, but this is the law. You see?
Okay. I have a question about repetitive consent too. You mentioned something about if there is no change in the situation. For example, blood transfusion in a thalassemia major patient, they come every month for blood transfusion. There's no change. Is it going to have it for a very, very long time? Can a transfusion be valid for more than one session, or is a transfusion consent required every time they have a consent? They come for a
That's
blood transfusion.
That's a very good question, actually. The law did not actually specifically said that you must take consent every time, but it is a good practice for you to get a contemporaneous consent. That is to say, you don't want the patients to say something like he or she got misrepresented, as in, for example, you have a group A positive patients that come for transfusion. Every time you are using the O positive types of blood. But in this particular time, for example, whereby you have hemolytic anemia, lah, for example, Dr. Allen's practice, in this particular session, you transfuse the patients with A positive blood. So there is some, actually, no doubt the blood is not changing. You're still giving the red blood cell, packed cell to the patients, but the group of the blood types change. So there are various of arguments you can, the lawyers especially, by looking through the documents, scrutinize every single detail, they can pinpoint your fault. You don't want this to happen. This is why, to safeguard your practice, it is advisable for you to repeat. Every time you have a procedure, there is a risk, please make sure the consent is taken prior to that.
Yeah. Let me tell you, let's say if we have a bone marrow transplant, the patient may have like 10, 15 transfusions during that whole thing. We can't be taking 10, 15 consents every time we have a transfusion.
Yes, this will be deemed as a course of treatment. Let's say, for example, the patients stay inside the hospital for a couple of days, for example, 5 days, for the same purpose only. Then you can say nothing has changed, nothing varied. But let's say if he is on the basis, he has to come back like 1 to 3 months for blood transfusion. So every month that he or she visit your clinic should take a new informed consent.
Okay. This is
Hmm.
all resulting in our folders becoming very, very thick, full of
Thicker and
consent
thicker.
form. I can tell you. Yeah, yeah, it's crazy. Even though we have electronic medical records, but keeping all these paper consents, Wait, let me go through some questions from YouTube.
Okay.
So Dr. Leong is asking, can patient request a copy of the consent that they signed?
Can a patient by right, all the documentations belong to the hospital. They cannot request for a copy of consent by right, but they have the rights to read it. And some of the time, you may come across with some patients or their family member. They will ask to snapshot, a photography of the consent form and let them study it thoroughly. There are certain type of patients like that. You have the right to say yes or no lah. It all depends on you.
Sometimes we do actually, this is actually brought up for discussion in my where we practice, so there was actually a question whether we should actually allow to give the patients a copy of the consent form, because some of the consent form are very detailed, for example regarding chemotherapy, and it's difficult, maybe they need some time to digest all the information.
Yes.
So we do give them unsigned, but just a copy of the consent. Go back and read, and then come back tomorrow, and then we discuss some more. Is that
Mm.
acceptable? But it's not the signed
That
copy.
that is absolutely acceptable. It will strengthen your case in the sense that you have given them adequate period of time. That is what we call as cooling period to think thoroughly about whether he or she really wants to go in for this sort of treatment or not. This will actually help the doctor.
Okay. Some series of questions from John Doe, but just a quick one from Dr. Nantini. I think you mentioned this, but just to clarify, is Advanced Care Directive legally binding?
No, at this moment of time, we do not have so-called an act or statute that said that advanced care directive is legally binding on the doctors. But
Okay.
it could be argued in such a way, lah. Let's say, for example, if it is an emergency condition, your safest approach is to save the patient if you do not know anything beforehand. But let's say, for example, if you know there is a advanced care directive or uh, allow natural death, so-called of living will from that particular patient, you can ask the patient's family to sign on the BHT. Hmm.
Okay. John Doe has a few questions. How has the shift from the Bolam test to the reasonable patient standard impacted the legal landscape for informed consent in Malaysia?
Uh, oh, how has the shift from Bolam test to reasonable patients impact the landscape? Actually, Bolam test, you have to look at the, how to say, Bolam test is not about the reasonable test and also particular patient test. Bolam test is referring to the standard of care provided by the medical personnel, so long they are in par with other colleagues, then it is acceptable. Whereby, if it is reasonable patient test and also particular patient test, it is more for informed consent per se. It is not Bolam, it is Fufiona. That means to say, if you are seeing this patient, like for example, I look like a superstar and I'm a model lah, or key opinion leader in the Insta famous. There is a scar. If let's say the surgery of one lipoma over my cheek area can cause a
Hmm.
scar, so I am in the group of particular patient test. Whereby if I'm just an ordinary old man, I would just need to know whether you can remove the surgery safely or not. So that is called reasonable patient test. Actually,
Okay.
reasonable patient test and also particular patient test did not disturb Bolam. Is the case of Fufiona that add on the what we call the standard of care. That means to say you must give adequate disclosure to your patients.
Okay. We will jump back to Slido. There are a few more questions there. For doctors do not want to work clinical but forced to work due to lack of manpower. That was not quite consent. It's actually more about forcing a doctor to work when he does not want to. Maybe we'll skip that now. We are short of
Okay.
time. Let's stick to just consent. Is there such a term as KIV proceed?
KIV proceed
Mm,
is very ambiguous in nature. The court will not allow something that is very vague, uncertain, or ambiguous to be accepted. You must make sure that, let's say, for example, KIV of what? Is it mean that you want to open the whole abdomen of the patient, or you just want to proceed with what? KIV is not a complete sentence. Please make sure you write what have you anticipated? What is the worst uh, form of surgery that you want to carry on for the patient? Not just write KIV proceed.
in obstetrics, we take consent for LSCS, verbal consent for instrumentation. Do we take informed consent for vaginal birth?
For SVD, is it? Like SVD, we
Yeah.
don't usually take consent from the patient. The reason is being SVD is just a natural birth delivery process. So you do not perform anything, just safeguard the whole process only.
Yeah, but this is the so-called natural birthing process now again fraught with a lot of complications. You can have
Yeah,
postpartum
yeah.
hemorrhage, may need hysterectomy. Your child may come up with cerebral palsy. We put all this down in a consent form. They sign it. Well, okay. I know there are a lot of questions from John Doe. I just have one I need to ask because it's about spousal consent. Because you said that you need spousal consent for where it is, especially reproductive organ or whatever. But let's say if the spouse had refused, and it is actually a life-saving thing for the patient concerned. Maybe not immediately. Let's say a malignancy, or he may need to have the womb removed, but the spouse refused.
If let's say the spouse really refuse, then you must respect the spouse. The spouse's decision. Let's say because we have switched from a doctor-centric approach to patient-centric approach. Not to say we want to practice defensive medicine, but seriously, a lot of issue may arise in the case whereby there are some concurring decisions from the patient and also the patient's family. Because usually patients, once they suffer from any type of loss or damage, they will not like siding you anymore. They'll listen to the patient's family or their next of kin.
No,
They'll
but
say
the
like,
patient is saying, I want it, but the husband refused. But patient say, I
okay,
want it, my life is at stake.
in this sort of case, I would strongly recommend two physicians involved. There must be co-sign to show to the court that, okay, so this is the consent done by the patient. I have one thing already. You see, I have two independent medical opinions to support that this treatment is necessary and also relevant to this patient. So there's no much room to argue.
Yeah, maybe good idea to get a second opinion and get another practitioner involved. Yeah.
Yes.
Okay. Uh, there's a question in the once we scan the physical consent form for electronical medical report, are we still obliged to keep the physical form?
The answer is yes. You must keep all physical documents for at least 6 years.
Okay, by
Yes,
law,
that
yeah.
is applicable for private practice and 3 years for government.
For why 3 years for government? Why is there a discrimination
Okay,
for the
in law, we have something called limitation period. If, let's say, for example, you do not get a lawsuit in private practice after 6 years, you have done a certain procedure, that means the limitation period will set in, then the action will be barred. Similarly, in government, we have PAPA, we call PAPA, PAPA. That is an act to protect frivolous claim. Like it lasts for more than 3 years, you cannot initiate a lawsuit against the doctor.
Okay. Uh, Question 2 from John Doe. Can you discuss the implications of Raja Azalina case, how it has influenced the understanding of material risk?
Material risk is still coming back to two type of tests that I have elaborated to you. That is reasonable and also particular patient test. But basically, material risk will vary from one to another. Like I have given you the example, if I'm the key opinion leader of Insta Famous, I will be very much concerned about my cosmetic appearance, for example, the scar, rather than the safety of the procedure. But material risk is something very, very, I would say, very, very subjective, because most of the time, why negligence really happen is that you don't even know this risk could actually materialize or happen. But somehow it happens, no?
The risk of death is material to everybody, I guess, because you don't want to die, isn't it?
Yeah.
Okay, so if I take a consent for a bone marrow biopsy, it's something a lot of people are afraid of, more pain or whatever complication. We have to tell them, reassure them it's very safe. But in effect, there is a 1 in 50,000 chance they can die from a bone marrow biopsy. It's to the patient, 1 in 50,000 like sounds like it's a huge number. So should we include that in the? It's a material risk or death. Should I put in a consent form? You may die 1 in 50,000 probability.
Okay, that is a very
And I
good
tell you,
question.
nobody will do a bone marrow. I can tell you.
Yeah, the doctors must strike a delicate balance between the therapeutic line, the white lines, and also the risk involved. We cannot be like disclosing every single risk under the sun. Am I right? But somehow rather, if let's say for example you are having a very bad luck and it turns out to be true that your patient died because of infection during the bone marrow transplant, you might
Mm.
be at a very high risk to get liable, if you don't tell them the risk.
Oh, bone marrow
So,
transplant, yes, we tell them there's a 10% chance you could die from the procedure. I'm saying about bone marrow biopsy, it's actually hardly anybody dies. But I actually seen one many years ago
oh,
at the government hospital. Yeah, but that's actually a very rare and unfortunate event. But
hmm.
it's something always crossed my mind. Should we actually uh, mention that in our consent form? For otherwise, it's generally considered a very safe procedure.
Hmm.
Yeah.
Yeah, I do
So
agree with
I
you.
mean,
You must mention it, lah.
but
Even though the
it is
chance is
something.
very rare.
Yeah. It's just like talking to a patient. I do appendectomy. I mean, how many surgeons would tell the patient you may die? There is actually a mortality rate. You can die.
You can die.
Yeah, it's true.
Yeah.
Even you do a treadmill, you could die. There is like 1 in 10,000 risk you could drop dead on the
Hmm.
treadmill. Yeah, but anyway, I just digress. Sorry, our time is short. Actually, John Doe is what, 7 questions. Sorry, John Doe. Yeah, now 20 minutes past the hour. Dr. Chi, are you all right to take a few more
I'm fine.
questions?
I'm fine.
Yeah, maybe I'll just zoom in on those specifically uh, which are related to consent. So, how should informed consent be handled in cases involving experimental or off-label treatment?
That will involve a lot of ethical issue, because to use those experimental and off-label treatments by right lah, every hospital or institution, they should have some sort of bioethic committees to overlook this treatment. You cannot simply give off-label or experimental treatment. But fortunately, we do not have any case law that specifically mention this area. So this area is really, really new. But in other country, by right, like what I have told you, you must go through the committee in order to give treatment of this sort to your patient. Okay.
Yeah, I think there's a difference between experimental and treatment, which is not experimental but already licensed or indicated, but you're using it off-label. So maybe the experimental one has more urgency to get institutional ethics approval before you
Mm.
implement it. But sometimes for indicated licensed medication or drugs, but we use it in an off-label fashion, we don't involve the ethics committee, but we counsel the patient. We are explaining this is on the basis of some current information or trials already conducted. But this drug is licensed for this particular indication, but we're using it for a separate indication based on the information available. I don't think we
Mm.
often involve the ethics committee for this. In the context of evolving patient autonomy, how should informed consent adapt when considering AI-driven medical decisions where causality and risks are opaque?
I'm afraid I do not have an answer for this. This is also a very new area.
Hmm.
Yeah.
Yeah, I am also not sure. It's quite opaque to me. uh, Last question. I think we have to call it a day, or night rather. In situations where emergency therapy, gene editing, so what are the ethical and legal boundaries for informed consent, particularly regarding unforeseen long-term risks? Hmm.
This is also a very quite new area. I'm not even sure whether we have gene editing in our medical therapies in Malaysia yet. So,
Coming,
but the
coming.
basic principle is
Hmm.
coming, yes. But the basic
Yeah,
principle is still lie with the four pillars of medical ethics, what I believe. But
yeah,
if you want to prioritize which medical ethics are more important in the eyes of court, I believe it is still patient's autonomy. And patient's autonomy is closely related to informed consent issue. Take for example, if really one day in Malaysia we are reaching, I mean, towards this gene editing treatment, then informed consent will plays a much greater role. That is to say, whatever risk that, whether it is long term, short term, high risk, low risk, you must all disclose to the patients. Hmm.
yeah. Very timely reminders. And with that, I think we just will close the Q&A, and we have to end up with the important bit, which is the CPD point. Yeah. Uh, for the dentist, I said there's already a pre-registration form on top. For the medical doctors, the link for the attendance is dobbs.my slash 280824. So you just open this link in your browser, whether it's Google Chrome, Safari, or whatever you're using, and you just type dobbs.my slash 280824. I can't place a clickable link on the video, but instead we have a QR code there. Please note that this QR code is not to be scanned by your MMA app. The MMA app scanning has been uh, unfortunately terminated already. So this is just use your normal QR code, your camera or QR code, which just will take you to this link, dobbs.my slash 280824. It's very easy to remember. This link will expire at midnight. Okay, but after midnight tomorrow, to claim points, uh, we won't use this form. No longer accepting response. How come? Wait, hang on. Let me check. Bear with me, short while. Let me find out what happened. Okay, sorry, I forgot to turn on responses. You can try again, please. It should be accepting responses now. Thank you for your feedback. Otherwise, there'll be a whole bunch of frustrated doctors tonight trying to register. Okay. Uh, can you all get the form up? It's enabled. Responses are enabled. Can try now. Lawyers, by the way, Dr. Chi, don't need CPD points, huh?
We do need CPD point.
Oh,
16 points per
okay.
year.
Wow. All right.
Yeah.
Do you still keep your APC so you don't need,
No, no,
or you
no.
stop it?
No
No more
longer.
already. No.
Yes.
uh, all right. Let me see. Okay, it's working now. All right. Okay. So anyway, this thing is still open for registering your attendance, and if you have any problem, please contact me the usual way. Otherwise, tomorrow onwards, we will have a way for you to watch and still can claim points right until June next year. So we keep the videos fresh, and I think it's a very good talk. So those who have missed it can still watch and learn from it. I think more important than the point is actually learning. I think I learned a lot from you today, Dr. Chi, because this is a very comprehensive insight into the whole informed consent thing. You know, there's so many things I actually didn't actually realize was so important. Okay, so I hope everybody just listens, and then if you forget, just watch it again. It's just hosted on YouTube for posterity. All right, so I think I'll wish everybody good night. So Dr. Chi, thank you very much again. Hope to see you on another time, and give us your insight. And I think your insight is so valuable because you see things from the perspective of somebody who's practiced medicine before, and now you're on
Mm.
the legal end. So that's a unique perspective few people have. Okay. All right. Thank you.
Thank you
And
very much.
good night,
Have a nice
everybody.
day.
Yeah. Good
Good
night,
night.
everybody. Yeah. Good night.